is Kristen. You welcome to the Roads podcast. It's Jill and Kristen, actually. Jill is here with Advocacy, and I'm going to let her introduce herself in a second. My name's Kristen. I'm one of the employees here at Ingham County Medical Care Facility. I've worked here 19 years. I am a nurse as well, but been in senior care, I would, most of my career. I started off as an aide at Eaton Rapids Hospital way back when. But other than that, I've worked in senior care. So I just have a lot of knowledge and experience, and I've lived in Lansing for 30 years, and so very familiar with this area. And both Jill and I are pretty active in the different fields and opportunities that seniors have in the Lansing area. So I think we're going to be a great team for you to listen to and get some knowledge from, which is the goal of this podcast. So our goal is to help you learn about services and really not just services, but how you can make an impact on your own care and your loved one's care when it comes to senior care. So Jill, can you introduce yourself, please?
Well, thank you. Hello, I'm glad to be here. My name is Jill Klauser. I work for Advocacy. I am a social worker, so you have the power team of the nurse and the social worker here, and I have been working in elder care myself for over 20 years. And both of us have worked in this field, but are also caring for our own families. So we are not only helping people take this journey, but we've also are taking it ourselves of how to get best care for the people we care about, and how to navigate the systems that may not always be the most user friendly, but we're going to try to share some tricks to the trade with you guys today to help you be ever better advocates for your parents or your loved one also, or yourself. So we're excited to start this.
Yeah, we're really excited, and we're excited to be doing it together. Like I said, between Jill and I, you've got about 40 years of experience. And yeah, it is. So we're happy to be here. And so this is our, launch party today, our first podcast. So today we're going to be talking about being an advocate for your loved one. We thought we'd start with that, and then we'll work our way through the process of senior care, because there's a lot to go through. So there's a lot. Yeah, there's a lot. We really want to start at the beginning and just talk about what it means to be an advocate for your loved one. And being on an empowered journey, not just a journey of this is something I have to do, but being empowered and feeling empowered. And
I love that word, empowered.
Gaining in confidence and caring for your loved one. And so that's what we're going to be talking about, not just today, but as we move forward through the podcast, really just that empowered journey. Knowledge is power. So, yep. Okay, so we're going to start with the basics today. So Jill, I'm going to have you start off with just telling the folks we'll start with the PCP, because that's usually where the journey starts, right? With the PCP.
It really does. Your primary care doctor, primary care physician, their roles have changed over the years. And I learned this myself is, we need to follow up with our primary care doctors. We need to visit them yearly, especially under Medicare rules of, they want to see you once a year for at least your Medicare checkup. But also, if you ever do need to go into rehab, the hospital, to get into home care, having a doctor who's following your care, knowing who you are and can write orders is very important, because it will create a barrier if you don't have a doctor. And I've made this mistake myself, was like, oh, I thought I'd been to the doctor, and then it'd been like 7 years. So it's very important. And especially if you're I'll refer to, working with your parents a lot, is knowing who their doctors are. Like, hey, Mom, what doctor do you go to? What specialist are you seeing? What, starting to paint that picture of what care your loved one is getting or not getting. And I've also found out myself, especially if they need to see a specialist, one of the barriers is there's such a length of when you're supposed to be referred to them to when you actually get into them. It's going, yeah. I don't know if you're experiencing that,
yeah,
but
for sure. I mean, I think, I had, well, not me personally, but my loved one had an appointment scheduled for see like a urologist, or the referral was made in November and the appointment's made for May.
Yeah.
It's nuts.
Yeah. So, accessing healthcare has become a real challenge, I think, for many people. And I think it becomes very frustrating for some of our folks they just don't go, like, oh, that 6 months out doesn't seem important, I'm not going to follow through. Or they get frustrated with the phone system, or they get frustrated because they're in pain now. And so helping our loved ones be proactive in making appointments, keeping appointments, is very important, because otherwise you get lost in the system sometimes.
For sure. And you don't want that, because once you're lost in the system, it's really hard to get back. And here's, without going to the hospital, is what everyone wants to avoid. And I would say too, if you're, an advocate or a caregiver of someone and you can't go to that appointment, see if there's a way that you can call in at a certain time and just ask questions, or, just make sure your loved one showed up, that they got there, that they made it to the appointment, and just see if there's anything, additional that the doctor didn't cover or that you need to know. Like, what if the doctor ordered an MRI, or what if the doctor ordered a chest x-ray or something? Like, you need to know what that next follow-up appointment is, so you can again follow up with the person you're advocating for to make that appointment gets gone to. Yeah,
absolutely. And I think that's a great segue into a lot of the doctors will do teleconferences now. They will let you call in. When my son was at his doctor's appointment, his dad put the doctor right on speakerphone, so I could ask all the questions I wanted to ask and what was going on at that point in time. And you did a great segue to that. And the other thing is, once you know them things, is talking to the doctor's office. Is there electronic chart that we can get on? MyChart is very popular where I'm at. I think Sparrow uses the same thing here. It's a great way with permission, for you to see exactly what diagnosis we're dealing with. You can see med lists. You can see follow-up appointments. You can see test results all in real time. And that's actually, I'm not always a big fan of technology, but I've actually learned to love that technology of, hey, I can just pull the app up on my phone and see, okay, wait a minute, I have an appointment 2 weeks from now. And it really helps keep, especially for our seniors who might get forgetful, or it's just too much information coming at them at once, where you can go, oh, wait, look here, Mom, this is where we're supposed to be and what we're doing.
1,000%. I think too, a lot of times, like when my loved one goes to the doctor, it's a lot of questions about when was this last checkup? When did you last go to the dentist? Because the dentist is important. We're going to talk about that in a second. When was the last time you saw the cardiac doctor? When's the last time you did this or that? And, like you said, it can be confusing for any of us, but for our parents or elderly folks, sometimes that can become increasingly difficult. And the answer becomes, I don't know, or I haven't gone in years, or whatever, when they just went. And so it's important, and it so helps with time, and you only get so long with the doctor, or you only get so long with the nurse practitioner or whoever you're seeing. And to spend most of that time trying to figure out when other appointments have been, or what, happened at those other appointments, is just going to take up valuable time that you have with your family. So being an advocate also means like keeping all that information straight. And like you said, if you can pull up that portal, oh my gosh, the portals have everything now, which is so great. It really is. Like you said, not always a fan of technology, but man,
we have come along.
And I mean, you can pull things right up. What did the chest x-ray say? Oh, well, hold on, I can pull it right up.
Yeah, and I think when we're at the doctor's office, we get so much information thrown at us that we usually grab 10% of it, and then we leave going, I don't know what happened, or we forget to ask the questions we want to ask. And I found with my doctors personally is I can send them an email through that portal, and they'll answer me, which saves me a trip to the doctor, saves me a co-fee of going in if you have that coming out. And I think they like it too, because then they can answer it in real time, and they just move on with their day versus waiting to get back in. So,
or trying to call and leave a message, or have their assistant call you back or whatever. And this way you can just say everything you need to say in an email. I love that.
Oh my gosh, I'd use it more than I realized.
I know.
Yes.
And to communicate with your PCP or a specialist too. That's the good thing. If you're within the same groups that use the same network, it's really nice because they can also pull it up, which is nice. So.
And it works for a lot of times it'll work for your med refills too.
Absolutely.
Or if you're at the doctor and they say if it doesn't get better, you can send them an email and then they'll call in a different script for you, and it's all right there for you, versus, especially this time of year, no one wants to be in the car around getting in and out, right?
It's been such a brutal winter. Who wants to go outside?
Oh my gosh.
Okay, so let's talk a little bit about some of those details. So when it comes to, getting in the portal, that's one thing. But even if you're at appointments or whatever, what's the information that as a advocate for your loved one, or as the caregiver for your loved one, what are some of the important things that you need to know about that person so that when things do happen, you've got the information right there. So we kind of talked about some test results, but what other things other than like birth date?
Birthday.
Yeah.
Every time you call, they're going to ask for a birthday.
Every
so just be
single time.
prepared.
Yep.
I think it's important to know someone's insurance. I don't
Yes.
think a lot of folks know that in and out of network, we'll talk more details about later, is a very important term of what is available to your loved one, what cost will be, and what is available. So knowing those things, because your insurance can create a barrier to care. And I know it's overwhelming. When we just had traditional Medicare, it was very, very easy for our seniors. Now it's Medicare Advantage plans and Part A's and B's and C's, and it gets all very
convoluted.
At a time. So I think that is important to know.
Social security.
Social security numbers, and knowing, and we talked about this earlier, knowing what our loved one, what's important to them.
Yes.
What is important to them. Everyone's at a different stage in their life. Everyone has a different comfort level. Everyone looks at the doctors and the hospitals differently. I avoid them like the plague. Some people find that to be comforting. They want as much doctoring they can get. Is that a word? I'm making up words now.
I think that's a good word.
I'm making up words now.
That's a good word. No, I think too. What's important to them may change on the daily.
Absolutely.
Like today, what's important to me is that my hip hurts, but tomorrow, what might be important to me is I have to get to the grocery store or whatever. And so, you got to kind of roll with the waves on that one as to what's important to them. But I think the bigger picture of what's important to them, and again, we're going to get to a lot of this in some future podcasts, but knowing what's important to your loved one, is going to make your life so much, because if your loved one's, says, I'm done with all this noise, well, then stop making appointments.
Guessing what their wishes are is not a good place to be in.
That's
so
1,000% right.
Having the tough conversations, no one likes to have them, but we all need to have them.
Exactly.
Because it prevents the crisis, or when the crisis does come, you at least know what direction to turn. And
as an advocate too, I would say you gotta know that the crisis is going to. It's not a matter of if, it's a matter of when. So being prepared is the biggest thing that I think we can pass along today. Just being prepared and knowing the answers to some of these things that we've already talked about, that we're going to talk about still today and in some podcasts, but having the answers and being at the ready just makes you feel a lot more comfortable when the crisis does happen.
Absolutely.
Like, you don't have to go, oh my gosh, I don't know.
Yeah. So I think today we really want to talk about, knowing the basics. So if God forbid you end up in the ER,
right,
or you have to call the ambulance, at least having allergy list, med list, knowing who the doctors are. I don't know if you've ever run into this. I run into people who are like, yeah, I'm not going to go because if I get in the ambulance, I'm going to get that bill. What does that look like?
Right.
That seems to be a bigger barrier for folks is getting to the hospital, or once I get there, how long am I going to be in the ER? How am I going to get home? A lot of our folks, that is a concern.
If I get admitted, what happens to my animal?
Oh my gosh.
The
animals.
What about some other barriers? I mean, yes, those are barriers for sure, but what about just in general? What do you see out? Because Jill's way more versed in, the home care world, but what do you see for people who, maybe are in a crisis, but just in general, like what are some barriers that you see?
I think some of the barriers we see with some of our elderly people is really how much they're hearing. I always go back to, ears. I always go back to ears, teeth, and eyes.
Okay.
I know it sounds kind of weird, but what I can see, what I can hear, what I can vocalize, what I'm understanding, because I think I do, we get frustrated if we can't hear what's going on. So we run into that elderly person who just nods and smiles and nods and smiles, and they have, have they been, do their hearing aids work? Have they got the batteries fixed? Have they gotten them cleaned out? That's a key piece, Can they see? Can they see, the documents they're signing? Can they see their pill bottles and what they're taking? I mean,
Huge.
you probably
Yeah.
see this as a nurse. How often are people getting their meds mixed up? Because that's
Yep.
really tiny print.
And how many tiny white pills how many tiny round white pills do you have? Like, you'd think they come up with something,
I know.
but there's not. When you look
No.
in the pill box, there's 5 white round pills, and then
Usually an
maybe
orange and a blue. We'll throw an
usually
orange and a blue. And
yeah,
that's
or
it.
pink.
Yeah.
But yeah, and getting to appointments in general can be tough. So what if you're someone who's working and you have a loved one who has an appointment? Like I said, that telehealth thing is huge. If there's any good things that came out of COVID, I would say that that's one of them, because it's
true.
used a lot now. But the eyes, the teeth, and the hearing, those are all huge, because if they can't eat, can't see, and they can't hear, like you said, what they're signing or what's going on with them or whatever, those are going to be huge barriers to care in general. And not only that, it's going to lead to a crisis.
It is. It is.
Because they can't, they're not able to, actively engage when they can't see or hear.
Yeah, and I think a lot of times we don't always know where someone is at cognitively, mentally, because we're asking questions.
Mm-hmm.
Again, they're doing the smile and the nod.
Yeah.
And it's not that they don't know. They just aren't understanding what we're asking them.
Exactly.
And with a lot of the new technology, there's lots of devices out there we can use. But starting with your loved one, of looking at them basics of, okay, what appointments aren't we going to because it's a barrier, whether it's transportation, or I don't want to bother someone to take me, or I call and I can't navigate the phone system because the whole press 1, 2, 3, 4, 5. I would love to know the data of how many people they lose because they get
how many people just press 0, because honestly, that's what I do sometimes. I'm like, I'm just gonna press 0 and
press 0 until I get somebody. Yes, absolutely.
I think too, in later podcasts, we'll have some transportation folks come in and just talk about, what does this look like if you need a ride, like what does this look like? And I'll be honest, my loved one is my husband, and he does take Spectran, and it has gotten so like second nature to use now. But honestly, I've always lived in a rural area. I grew up in a rural area. Yeah. I've always lived in a rural area. So using a bus wasn't familiar to me at all, just because I didn't grow up in an area where there was a bus system per se. So now to live in East Lansing, where there is a bus system, it's something to learn, and it can be a little daunting. I'm not going to lie, but there's so many resources out there for, and so all those things are just,
Yeah. And I think there's, if you're listening to this podcast, hopefully there'll be people listening, and you're in that moment of, I don't know, there are resources out there you can call for free that will help you. TCOA, Tri-County Office on Aging, Department on Aging, they all have information referral specialists of, hey, we're just kind of stuck here. Can you help us find someone to help with transportation or the Meals on Wheels, or help with the Medicare and the MAP counselors? And we're going to talk about all these things, but there are lots of resources out there for folks who are navigating healthcare. It's just a matter of reaching out, and a lot of them just making them phone calls or
and Tri-County Office on Aging, huge resource for people. I think too, isn't there in our community, you might know this better than I, social workers that literally, my husband's been in the hospital before. I don't know what we would do without social.
Oh, okay.
Do you need this? Do you need that? How can I help? Like, they have all the resources. That's their job, so. There
are social workers that are in a lot of our entities. Okay. If you're in the hospital, ask for a social worker, ask for the case managers. They're the ones that are supposed to be helping you navigate this. Look at what services can come into the home, whether they need to go to rehab. Exactly. They are there to answer your questions, to kind of be that communication piece between the doctor and what's going on with your care. Because when you're in the hospital, the doctor's going to make rounds, and if you're not sitting there,
you don't get involved.
You're going to miss that meeting.
They do the round and they move on to the next.
Yeah,
absolutely.
So ask for your social workers in your rehab centers and your nursing homes. There's some really good ones here.
Yes.
Your home health care agencies and your hospice agencies also have social workers to help deal with whatever stress you may have going on. They don't do clinical stuff, but things that are anything from the Meals on Wheels to funeral planning to, we're worried about the kids because we don't know how to explain hospice to them, or palliative care. So there are some really good tools in place and folks in place. Sometimes you just have to ask.
And I don't think either one of us can stress more, like, to get some of these things going. This part seems like a lot, but it's the most important part. Without an advocate, or, if you are the advocate, without having all the information that you need, it can make life a lot harder. And like we said, when the event happens, that's not the time to figure out how to get into someone's MyChart, or know when their last CAT scan was, or MRI,
What
or
their
doctor's
chances.
appointment, or med changes, or, like, that's not the time, because now it's kind of too late. So
There's nothing more frustrating when you're worried about your loved one. You got someone coming in and
yes.
asking you these questions, and you're going to be like,
Yeah.
but my loved one's in pain. Let's focus on
Yes.
that. So
Yeah.
it's good to just have that stuff. If you put it in a folder, whether you
Yep.
take pictures of it, whatever you have
Exactly
with
what I
you.
was going to
So
say. Yep, most of us in today's world have smartphones. So use your notes section, or, like Jill said, take photos, like write out a med list and take a picture of it. And then every time a med gets updated, update that and take a new picture. And keep it in a spot in your phone, find it. Those are all things that are going to help your stress, because, like Jill said, when you're in the hospital or you have someone that's in pain, the last thing you want to do is have to figure out all of the answers to the questions. You want to just be with your loved one. This is going to allow you to do that. So get the information, have it handy. If there are barriers, reach out. Like Jill said, TCOA, the case managers of the hospital are invaluable. They're amazing. And again, a lot of our case managers, they know what's going on in the world,
they do.
and they can say, okay, well, I've never had home care before. Okay, well, tell me what's important to you. Do you want this? Do you want that? Because home cares offer different things. Do you want a home care that's close by your house? Does it not matter to you?
Yeah.
All that kind of stuff.
Yeah.
So very, very important. What else can we talk today, my friend?
We can talk about all kinds of stuff.
Let's go back to the PCP a little bit. I just feel like that's such a huge thing. What if your loved one doesn't have a PCP? Advice.
Well, that is difficult. We're running into that as a barrier for some of our folks who are trying to get home care. We have to have the PCP in place.
Can you help with that?
We can help with that.
Okay.
Again, it's a scheduling out thing of when you call around and ask to set up as a new patient at a PCP, they're scheduling a couple months out. So if you're in that crisis, you're kind of in trouble. But there are also visiting physician groups that will come right into the home.
Yes. I don't know if people know that. There is.
I don't know if they know that either.
That's a great thing to talk about.
So there are some companies where that visiting physician can come right into the home, and usually the timeline's a lot shorter than a standalone a doctor's office of getting in there. So we've referred a lot out to them, just especially if someone's coming out of the hospital or coming out of rehab. They're, one more appointment going out just isn't high on something they feel like they can do yet.
I agree.
So a lot of times,
the transportation thing,
and that darn transportation,
this takes it right out. You don't need transportation because they come to you. I think a lot of people think, oh, doctors don't do that anymore, but they do. There is doctors that do that.
They do, and they can bring in, the lab work. They can bring in the X-rays. They can bring a lot of things into the home. And even if it's a temporary thing of, I'm just going to have them come in, and then 3 months from now, I really want to go to Dr. So-and-so. Yep. I've heard good things about them. It's a nice bridge. It's yes. We don't want you to be without medical care. So your PCP really drives your care. They order the specialist. They set up all your orders. They set up your meds. So it's important to keep up with them. Yeah. And I think there's a yearly visit under Medicare that is covered. So go do that yearly visit.
And required. Is there one that's required?
I think it is required. So they can at least eyeball you, see what's going on. Heck, meet your doctor. I've never met mine, but I know I have one. I've always gone to the nurse practitioner. So
yeah, that happens.
It happens a lot.
Yep. When you see that nurse practitioner, just know the office, right? And so that way, if you are with your loved one and you're in the hospital, what doctor do they see? Oh gosh, I don't know, but they always see the nurse practitioner, Kristen, and okay, well, what office is it? And you tell them, and they can call and figure out who the doctor is. And because that does happen more and more now, that you see a nurse practitioner or a PA instead of the physician.
Yeah, and always make friends with nurses, because you can always make friends with nurses. So you can call them.
That's right. Always make friends with nurses, because
they are the best advocates. Wherever you're at, the nurse will figure it out and get back to you.
Yeah, for sure. Okay, what about is there any other thing that you can talk about when it comes to MyChart? I think one of the things as an advocate, just from a nursing perspective, that you should watch for are they're going to do vitals at every visit. So see what those are. I mean, some people think, oh, whatever. Know what the normal ranges are for blood pressure. And then again, the nurse, the MA, which is the medical assistant in the doctor's office, sometimes the doctor, they can all explain that to you. Oh, this is, what the range is. So that way, if you're at the doctor's office and they can give you a range of what that blood pressure should be. And that's going to help you, because if you take a blood pressure at Meyer and all of a sudden it's 256 over 120, that's way too high. Okay. So that's the time to call, the PCP and go, hey, my mom just had her blood pressure taken at Meyer and this is what it said. Is it going to be accurate at Meyer? Maybe, maybe not, but it's worth a check because that's super high.
Oh.
So just thoughts,
Yeah.
on
I think the med list is important because
yes,
and I'm gonna let you talk to that because I think there's so many folks that end up in the ER because
took their meds wrong, took the wrong dose. So if you're the advocate, I would say it's super important to get a med box, whether it's AM, noon, PM, or AM and PM or whatever. I do my husband's meds every Sunday. That's just part of my Sunday. That's what I do. I get them all ready for the week and he doesn't have to worry about it. They're all done. And I think that's important too. Refills, because how do you know if you need refills? Those aren't usually just automatically done for you. So you'll know, like on Sunday, you're like, oh no, I don't have enough to get through the full week. Call and get that refill ordered for them. A lot of places deliver, which is so awesome now. Walmart delivers. I think Target delivers. So if you get your prescriptions filled there, sign up for delivery. It's worth it because then they just deliver them to your loved one. And then when you go back on Sunday, the pills are there. So those are huge because running out of medications, not taking certain medications or doubling up on medications are definitely things that is 1,000%.
And do you find and if you go to specialists, are the specialists talking to the PCPs and are we getting meds mixed up because are the doctors all communicating with one another? And as I'm asking you this as a nurse, right?
Yeah. Mm-hmm.
You go to one doctor, they give you one pill. You go to another doctor, they give you a different pill. And suddenly you have 3 different pills to lower your blood pressure and you're falling down. And
right. Because
no
your
one's
blood
catching
pressure's
that,
too low.
right?
Right. So usually what you want to do is get your meds filled at the same location. Don't get your meds filled one day at Target, one day at Walmart. Get your meds filled at the same place because that pharmacist there is the one who should be watching for that and saying, hey, this is way too many medications for you to be on. I know we get our meds filled at Walmart. They'll even call the doctor's office for you, which is really nice to say, hey, they need a refill. There's no refills on file. They need a refill. And they'll just take all that off your plate, which is so nice. But that's why the med filling is so important because if you're the caregiver, you can be like, wow, there's 4 meds here for blood pressure. I feel like that's too many. It is. It's too many, and because some of them are going to do the same thing. And now your blood pressure is way too low, which can lead to falls. It can lead to confusion. It can lead to fatigue, all these things. Same thing with, anything like that. Pain medications. Oh, that's another one.
Oh my gosh, yes.
Interact with medications. So again, you want the same pharmacist looking at your medications. You don't want meds from different pharmacies. That defeats because the pharmacist too is knowledge with that stuff.
And I think there's a consistency if you're using the same folks. They get to know you. They're invested in who you are. They're invested in your loved one.
Absolutely.
There's a relationship there of when you walk in and they're like, oh, hey Jill, how's mom doing? Or blah, blah.
Yeah.
I think that really leads to better care because then you're comfortable talking to them if you do have questions.
Absolutely.
Because some of us do get intimidated of talking to someone we don't know. I'm not one of those people, but other people are. I'll talk to anyone.
For sure. And I think especially like we kind of said at the beginning of the podcast, if you don't have a lot of confidence in what's going on with your loved one, that's when that happens, or they'll say, oh, we'll just fill all these meds before you leave the hospital. Great, because you have the meds to go home. However, that doesn't mean that you add them to the meds you're already taking at home. That's the issue, right? So usually what I do is if my loved one's in the hospital and they want to call in meds, I tell them the pharmacy because I get my meds delivered because I don't need another trip out. And they can be the ones to say, oh, I see they've added on Norco. So you're already taking X, Y, and Z. So we're going to, you can't take both. So we'll call your primary care and see which one they want.
Yeah.
So that's where also that primary care again important because you're going to be the one managing all this and you're.
Yes. Don't Always ask questions. So
Always ask questions.
I want I want to leave us with a little wrap up here.
Yes.
Of a to-do list for folks,
Okay.
because we Kristen and I could talk all day.
We sure could.
But we want you to leave with valuable tools and things of like, okay, these are the next few easy steps I'm going to take. So as I'm working with my loved one, I'm going to be prepared, or at least start putting that groundwork into place of not having to scramble in the ER. The ER, God bless the ER, but I hope nobody ever has to go there, right? So we want to know who primary care doctors are. Have a list of who your primary care doctors and a list of specialists. I think that's a great place to start. Copy of insurance cards, because as soon as you walk in the door, that's the first thing they're going to ask you. And you see the insurance card.
Yep.
If there is a way for you to access the MyChart for your loved one, or even for yourself, all of you out there should be doing that for yourself. If you call the doctor's office, I know my doctor, you just call and they'll give you the code. They'll give you a little flyer of how to get into that and get signed up. You can download an app. It can go right on your phone. You can put on a laptop, whatever it is. So that will save you a lot of time and energy, because actually, if you're into MyChart, everything I'm going to tell you to do is already in there.
Yep.
The list of the specialists, the list of the meds we're on. That's where I would start as an advocate of.
Same.
Do I know? Do I know what's going on?
What do I know? Yep. And really just the basics. Med list, the primary care, the specialist, maybe a couple diagnoses.
Yeah.
You know, I think once you have those things, you have a lot more tools than a lot of people. So that's a huge thing. Like if you've got those 4 things, really you have a lot, and you can give all that to the caregivers when the crisis happens. And
I think them are easy things for our folks that are a little more private and don't like to share, because I don't know. There are folks that don't like to share everything. That's an easy, hey, let's just get this stuff lined up. Yep. So
I just need to know the basics. I need to know everything that's going on with you, but I just need to know the basics so that if something happens, I at least know your social security number and your date of birth, and because we don't, it's not just necessarily our family. It could be neighbors that we're caring for or whatever. And so you need that information. So
and then it easily rolls into, and if you can, then it easily rolls into what things are they concerned about, because if we can always take the angle of what it's top priority to them, you're there to help them and continue what our values and what's important to them, because that way they know you're on your side.
That's right.
You're not going to be a little too bossy or pushy, because I might have that problem. But they're still in charge and driving the ship of their care.
Love it. Well, hey, make your journey an empowered one. Thank you, Jill. Thank you, Kristen. We're just so happy to be here with you guys, and we're going to keep going with this podcast, and we'll have some more information for you on the next one. And pretty soon we'll have a way for you to send in some questions for us and all that good stuff, so we can make sure that we're getting you the information that you need. Well, thank you so much for joining us today. This is Kristen and Jill, and we will see you soon.
Bye-bye.
Bye.